Hi, my name is Danielle, and today I would like to discuss a recent and significant bioethical issue that occurred in December of 2022. This event, deeply rooted in ethical dilemmas and challenges, involves a baby known as Baby W, whose parents refused a life saving operation because they believed the blood should come exclusively from unvaccinated donors. In New Zealand, a 6-month-old baby needed urgent surgery for a congenital heart defect. His parents demanded a guarantee that he would only receive blood from unvaccinated donors if it became necessary. The New Zealand health authorities became involved and cited the risk of setting a dangerous precedent. Subsequently, a high court judge granted the health authorities guardianship for the duration of the surgery and related medical treatments. The case attracted attention and was the focus of major anti-vaccine protests. The primary bioethical dilemma is the parents' refusal to consent to a standard medical procedure due to their beliefs about vaccinated blood. This decision poses a significant risk to the child's life and well-being. The conflict between parental rights and the child's best interest, alongside the implications of setting a precedent for blood donation preferences, constitutes the core of this ethical challenge. So, the primary principles that were challenged were beneficence and non maleficence. Refusing the blood transfusion threatens the child's health and survival. Autonomy, the parent's autonomy in making decisions for their child, conflicts with the child's right to receive life saving treatment. And third, justice, allowing parents to dictate specific criteria for blood donations could lead to inequities and unrealistic demands in the healthcare system. And this event is extremely significant to my profession as a nurse, as it exemplifies the complex interplay between ethical principles, parental rights, best interests of a patient, especially when the patient is a vulnerable child. As a nurse, navigating these dilemmas is a critical aspect of our role. This case highlights the importance of advocating for patients' well-being, especially when they cannot speak for themselves, the challenges in balancing respect for families' beliefs with medical necessity. It reinforces the need for strong ethical guidelines and effective communication skills in healthcare. So here are some relevant provisions from the Code of Ethics for Nursing. Provision 1, quote, "The nurse practices with compassion and respect for the dignity, worth, and unique attributes of every person," that is cited by the ANA. In this scenario, the nurse and healthcare providers respected this provision by prioritizing the health and well-being of baby W. Provision 2, the nurse's primary commitment is to the patient, end quote, also from the ANA. This provision was also respected. The nurses and medical team prioritized baby W's health and survival over the parents' demands for unvaccinated blood. This issue raises critical questions about the limits of parental authority in medical decisions and the role of healthcare providers in ensuring patient welfare. It highlights the need for clear guidelines and policies regarding such conflicts, especially in a world increasingly influenced by misinformation. The case also demonstrates the importance of effective communication and collaboration among healthcare providers, legal systems, and families to navigate complex bioethical issues.